Time now for Medical Monday. Dr. Johnson is here with us now, one of our favorite docs to have on the show. We're talking about ovarian cancer. First of all, explain what this type of cancer is and things like that.
It's cancer of the ovaries. There's about 22,000 women who will be diagnosed this year with it, 14,000 deaths, so it's a fairly very aggressive cancer, so it's important that we listen. It whispers, so listen.
Absolutely. So, and that's what we were talking about during the break, that a lot of women don't know they have it until they have it, and it's in that, significant form.
A lot of women are diagnosed when it's an advanced stage, stage 3, which has a much lower cure rate than stage 1. But there's signs: bloating, difficulty eating, where you fill up very easy, abdominal pain, trouble urinating, trouble defecating. BEAT, B-E-A-T is the mnemonic for it.
Gotcha. Okay, so those are the things we need to look for, and at that point, that's when you go talk to your doctor and say, hey, can I get testing or something like that?
Yes, ultrasound would be the forefront.
That's
there.
the way.
Really, ultrasound is the best thing. But prevention, how do we prevent it? Genetic testing, and then intervening for those that are genetic test positive. If you're from a high-risk group, if somebody has a history of colon cancer, breast cancer, rectal cancer, they should have more frequent screening.
Absolutely, because those are all cancers that are related, right?
Yeah, and if someone's having a hysterectomy, they have the tubes removed, we think many of these actually start from the fallopian tubes rather than the ovary itself. So that's an easy way. Tubal ligation cuts the risk. Using oral contraceptives cuts the risk. So lots of ways to reduce the risk. Okay,
so for a woman who's, in her early years, her 20s and 30s, you're talking about birth control, things like that?
Yes.
Okay, and then also I read breastfeeding. Is that true?
Breastfeeding. The longer one breastfeeds, the lower the risk.
Really?
The more children. So you could have several more children. It'll cut your ovarian cancer risk.
Ooh, I don't know about the several more children. Right now, I think we're going to stick with 2, Doc. So, what are some of those latest treatments that you do? I mean, is it an invasive kind of treatment, or is it something a little less?
Well, the mainstay of treatment is to remove every speck of the cancer you can find. And that's why it's so important to see a gynecologic cancer specialist. This is what we're trained to do. It's been shown to really cut the death rate with this. There's also newer chemotherapies, ones that we administer directly into the tummy. We have a lot of studies that we're doing looking at other therapies. Newer biologic agents, using the molecular fingerprint of this and adjusting our therapy directly to that.
Absolutely. It's all about listening to your body, and when you think something's wrong, go to that doctor immediately.
Absolutely.
All right, wonderful advice. Thanks so much, Doc. For more information on how to reduce your risk for ovarian cancer, just go to our website, NBC26.com, and click on this Medical Monday link. You're watching Wisconsin Tonight. We'll be right back.